even if there was a 0.5% of market share, that would be a $1 billion business.
Is that the reasonable percentage you're going for?
We're not making any forecasts today, David, but I mean, we have to think at scale. We can solve for some of the cost issues within the system and hopefully reduce the cost of health delivery over time. So that creates a great opportunity for us, not only to build a great business, but also solve for many of the pain points that Australians incur as they touch the health system.
To what extent does this business raise the ante on broadband? Sharing of medical information, particularly to remote areas, was a big selling point of broadband. Does it raise the ante?
I don't think it changes the nature of the pervasive access we have, whether it be mobility or broadband. Most of the information we're looking at today doesn't require significant increase in broadband beyond what the NBN will offer or what we're offering through our 4G networks today. So
but you agree that was a big selling point of the original model for that, and is the model we're going to get now going to be sufficient?
I'm not here to discuss the NBN model, what's sufficient, what's not. What I'm here to talk about is launching Telstra Health today.
I appreciate that, but what I'm trying to establish is that the sharing of medical information do you agree, was a big selling point?
The NBN will play a role in better connecting all Australians to the healthcare system, absolutely. The more customers and patients that are connected through that system, the better, and we believe we can deliver better outcomes for patients through a better connected system.
And so with this idea of the telemedicine and connecting to a GP, there's a level of self-diagnosis that occurs there before you choose to either go your way or call an emergency line, isn't there? Mm-hmm. You agree with that? How's that going to work?
So today we're launching a joint venture with Medgate to create a company called ReadyCare that's going to offer telemedicine consultations here in Australia. Medgate bring 13 years of having developed protocols to safely diagnose certain ailments by telephone, and for those that are not, they're then referred to a doctor or emergency department. So part of the attraction of partnering with a best-of-breed offering that's tried and tested in Switzerland and takes 4,500 consultations every day today in Switzerland is to take that model and apply it here in Australia.
How many
consultations? Can I just clarify?
Are
you guys actually employing doctors? Is that right?
We will employ doctors. Well, as you heard today, Art, we have a team of people who are intimate with the healthcare system, some of which are doctors.
But you went to great pains to say you're not medical professionals and you're not doctors, but you are employing doctors. Is that?
We will. Our ReadyCare offering is to provide telemedicine and consultations to all Australians on a national basis. But within that joint venture with Medgate, we will employ doctors and clinicians to support that service.
Are there any examples overseas of carriers being this intimately involved with the healthcare system?
So Medgate is actually very intimately involved with Swisscom. They're a significant shareholder. So we have some proven examples where telecommunications and the health systems work together to develop new systems that offer better health outcomes and greater access as well.
How will you think the model of Medgate in Switzerland will apply to Australia, where their population is much more homogeneous than ours, which has got huge racial, cultural, ethnic, language diversities?
Well, sorry, I was about to say that, well, in Switzerland, we have 4 languages spoken in Switzerland, and we have diversity in Switzerland as well as in Australia. We really believe many of the things we've tested around our Medgate relationship makes them absolutely fit for purpose for us to offer a quality service here in Australia for teleconsulting.
How many consultations do you envisage doing, and how big will the workforce be, the medical workforce?
We're at the beginning of launching the joint venture today. We're building the capability. We'll probably be launching over the next 9 to 12 months the actual service. So at that time, we'll provide an update for you.
No, you must have some projection on consultations and what sort of things people are going to be treated for, though.
Would you like to talk about
consultation? I mean, they're minor ailments. And there's an initial triaging process within the system, and I think, as Gordon said, we'll gauge the demand and build the service up over time. But if we're going on the only guidance we can give you is the demand in Switzerland.
Will you use the unique identifier that the government is putting in place, and who owns the data, where all the data reside, and what access does the client have to that data?
We're certainly committed to a national integrated health information system. Wherever possible, we will work with NEDA standards. We're very committed to NEDA standards, and that includes the individual health identifier. The Medgate solution is a telehealth offering and telemedicine offering, in its own right.
So security around information then will be
Security
guaranteed.
is fundamental, and I think those of us that have spent our life in healthcare are acutely aware of the need to keep data private and confidential. I think it represents one of the great strengths of Telstra, that it currently hosts the PCHR, the National Health Record, and I think is trusted by Australians to keep information private and secure.
So Medgate is a separate service, so that has a separate identifier. Is that what you just said?
I think there is a health IT system that will be created as part of the Medgate service, or ReadyCare service, I should say, and we are working with Medgate at the moment about how to adapt that into the Australian circumstance.
So you spent $100 million setting this up over the past 12 months. What's the typical investment profile going to be going forward?
We will continue to look to invest to build capability here in Australia. We've only just begun. We're not giving any forecasts.
What's the ballpark?
I'm not giving any forecasts. But thank you for asking.
Is it fair to say that fibre to the premises is not required to use ReadyCare? Because that's often the pitch for the NBN, that you need fibre to the premises for the not only the speed but the latency and reliability of service for telehealth.
Just to, in terms of ReadyCare, it's both telephone based and online based. The initial adoption, I believe, will be highly focused on telephone based consultations. So a PSTN line will be sufficient, because we're trying to give access in remote and regional Australia as well, and we're trying to reduce any dependencies on infrastructure. But we can deliver a service across a good old PSTN line. But as time goes by and we're sharing more information, collaborating more with allied health workers, care coordination, clearly that need will grow over time, and that's part of how we'll evolve the service.
So you've talked about your own revenues, but how much cost do you think you can cut out of the health system?
Look, we're not going to give any projections on how much cost. We have to do that in collaboration with government, working in partnership with major providers.
But for every dollar you save, we'll give you this, or every dollar they save.
We're not making any projections on the reduction on the cost and the tax burden on health.
There's already a national taxpayer-funded telephone triage service called Health Direct. What's going to happen with that, do you expect?
Well, I think that's up to the government. The service that we're creating doesn't only provide advice, it provides diagnosis, prescription, referral to specialists. So it's a more complete service. It's what we would call a definitive consultation that substitutes for a face-to-face consultation.
Did you look at Australian services like GPDU?
Sure we did, yeah.
Last minute advice, sorry.
Sorry?
Yeah,
Last minute.
how is ReadyCare going to be billed? How's the billing process work? Talk us through that.
Look, as we say, we launched the JV today. We're still working through some of how we're going to choose to bill customers in that regard, or whether it's provided through other services. So we're working in partnership with insurers and providers to say, what is the right model to help service your patients in the most effective way through the service.
Private clinic type of situation. It would just be like a private clinic that you would go and walk into normally.
It may be, but we haven't made any final decisions on how we're going to be managing.
Would you bundle the service with a Telstra in the board?
We think that, creating Telstra Health, we're building a health business. It's going to be a market leader in e-health solutions. It's a standalone business. It's entrepreneurial. It's growing. We will take advantage of the opportunity Telstra provides in providing many services to our customers today, but we believe we're uniquely positioned to work with providers and funders in the system to really just create a better health outcome for everyone.
But ultimately the patient is billed.
We're still working through what the models will be in terms of the funding.
Has Medicare indicated that they will support your service?
We'll work with government as the service unfolds. We look at what value it is, particularly in rural areas. The model at the moment is most likely to be through companies rather than direct billing to consumers.
And does a $7 co-payment,
guys.
Does a $7 co-payment really make it more attractive for a billed service rather than Medicare?
I think the service itself will be what's attractive, and people will discover what value is in it.
I'm sorry, I don't understand billing companies. Can you talk? Is it patient billed or not? That's a straightforward question.
It might be that a company, for example, a mining company, pays on behalf of its employees. So that's the model. That is one model we can look at.
Thanks very much.
Thanks, guys.
Thank you.
Chris, we can set something.